Good morning. Today we'll be talking about optimizing your fertility health. Fertility and issues to those having children are very, very important in our society. And so it's something that we need to deal with. Good morning, Dr. Ali. It's a pleasure to have you with us.
Good morning, Dr. Pamela. My pleasure to be here.
Now, we are talking about fertility today, and people think, we talk about fertility often, on and on and off, but amazingly, as a subject, it is still actually one that has stigma. Even after all these years of discussions and people, trying to explain the issues around fertility, it's actually surprising how many people still, when you say, "Oh, let's talk about fertility or whatever," even in casual conversations, "Oh, no, it's not my problem. Oh, I don't have a problem with that." And they're so defensive. Um, so the topic we're talking about today is optimizing your fertility health. So what does optimizing fertility health mean from a clinical perspective? And when is it that people should start thinking about it, since it's still such a big issue in our society?
Okay. Optimizing fertility health means taking steps to improve your chances of conceiving and having a healthy pregnancy. It also involves enhancing both physical and lifestyle factors that influence reproductive health in both men and women, okay? So this is often the first step to take for couples that are trying to conceive. And it's also essential for those planning to conceive in the future. All right, so the best time to start to optimize your health is when, one, you plan to conceive in the future, and secondly, you're trying to conceive as it is now.
Okay, so once you're thinking about getting pregnant, about having a child, you should be thinking about how to look after your fertility and how to optimize your fertility. That's what you're saying.
Yes.
Now, can you talk about generally what is infertility and what are the most common medical or lifestyle factors that influence both male and female infertility?
Okay, infertility is the inability to conceive, irrespective of having regular sexual intercourse, which is stated as 3 times of unprotected sexual exposures, 3 weeks, 3 times in a week for 1 year. So you're trying to do this, you're having unprotected sexual exposures, you're doing that 3 times in a week, and you have done it for 1 year. So if you are unable to conceive, that means that there's a bit of infertility or subfertility. All right. So the medical factors that can affect infertility, we have both in men and we have both in females. All right. For the female, we have things like polycystic ovaries. Some people say it's a hormonal disorder that disrupts or affects ovulation. So these are factors that can actually, medical conditions that can affect the ovaries. So I've talked about polycystic ovaries. So I'm talking about endometriosis.
Can you, well, don't, if you can't do it, because when you just mentioned polycystic ovaries, you can just give a brief explanation of what it is, because we're talking to lay people here. So people may not know what you're talking about. So a bit of an explanation with what it is when you say polycystic ovaries or endometriosis, just a bit of an explanation with that.
Okay, so in a layman term, the ovary is the part of the woman, all right, that plays the most important role in reproduction. Like the ovary is the part of the reproductive system, part of a woman that actually houses the eggs. So in the ovaries, the particular place where the eggs are housed are structures that are called follicles. So some women are born with more follicles than the other women. So when you are taking like an ultrasound scan and then you're looking at a woman's follicle and you have more than 12 follicles in each of the ovaries, okay? We say this woman has polycystic ovaries. So when we are talking about the polycystic ovarian syndrome right now, we are looking at one, that you've confirmed the polycystic nature of the ovaries, and then you have things like hormonal imbalances. You have things like the male pattern hair distribution. You have the menstrual abnormalities. You have the menstrual abnormalities. You have the
Okay.
male pattern hair distribution. Okay, you have irregular periods, then you have the infertility as a whole. So when you have all of this, and then you have the polycystic ovaries on ultrasound scan, you can say a woman has polycystic ovaries. So nobody can say for sure why that is so. Some school of thought to say is a structural problem. Some say is a hormonal problem where a woman has more of the male hormone, the testosterone, as against the estrogen, which is the feminizing hormone. Some would also say, okay, this also has to do with the way the body responds to insulin. All right, the body does not absorb insulin or does not absorb glucose as much as it should, because the receptors are not sensitive to the insulin receptors are not sensitive to the glucose.
Yes.
All right, so some people say it's a structural problem, some people will say it's a hormonal problem.
All in all, we're saying that it's an ovarian problem, and this is, you just sort of summarize what it is. Now, endometriosis, what is that? Just briefly, not so much detail.
Okay, so we have specialized cells that lines the endometrium. In a layman language, the endometrium is the part of the uterus actually that houses the baby. So that particular part of the uterus is lined by specialized cells. So when you begin to find those kind of cells outside the ovaries, for some people you find it on their skin, for some it's outside the uterus, sorry. For some people you find it in their skin, some you find in the muzzle of the uterus, some you find on the ovaries. Okay, so when you find these cells outside the endometrium, we say it's endometriosis. So we're going to talk about endometriosis as it affects the eggs, as it affects the ovaries. So when we have these structures on the ovaries, you say, okay, this woman has endometriosis.
Okay, so that's a form of infertility, female infertility. Are there any other kinds of things that, are common medical conditions that cause infertility? The reason why we're talking about it now is because when we want to talk about optimizing your health, we just want to mention some of these things, but obviously not go into so much detail, because though they are actually a subject matter on their own. It takes a whole program to talk about PCOS or endometriosis. But if you can talk about some of the common male issues, that would be helpful as well.
Okay, so for some of the common male issues, we have the low sperm count. All right, so when you are assessing a man's semen parameters, we do that in comparison to WHO standards. So when you have reducing or reduction in the main parameters, which are one, the concentration of the sperm cells, then you're talking about motility, and then the normal forms of the sperm cells. When you have a sperm count or concentration of less than 16, or motility, the way the sperm moves, because the sperm has to move from the vagina to the fallopian tube where it will fertilize the eggs. So when you have less than 42% of the sperm cells moving, or less than 4% of the sperm cells having normal forms, a normal sperm cell has like a head, a neck, and a tail. Okay, we say this man has abnormal semen parameters.
That is getting worse, isn't it? Because one of the things that we've noticed is over the past century, even the definition of normal for men keeps dropping. So that's something that is quite alarming, and something that needs to be looked into. Please carry on.
Okay, so we also have varicocele, okay, which is the enlargement or the engorgement of the veins around the scrotum. This can cause an overheating of the testicles and reduce the sperm quality further. So we have hormonal imbalances. So when a man has low testosterone, which is the main male hormone, or issues with the pituitary gland, which is the part of the brain that regulates the way reproductive hormones are produced. All right, so we have infections, polytreated sexually transmitted infections, or mumps in childhood. This can also damage the sperm producing organs. We also have genetic disorders. All right, we have congenital abnormalities. We have pelvic surgeries.
So there's so many things, in short, that can cause issues with male and female fertility. And those are just specific to fertility. How about other conditions, chronic conditions? Do conditions like diabetes, thyroid disorders, and things, do they also affect fertility? How do they impact fertility?
Yes, factors like diabetes or thyroid diseases, yes, can affect fertility because it can cause hormone imbalances, as poor blood sugar control can disrupt reproductive hormones like estrogen and progesterone in the women, which will ultimately affect ovulation, and this can lead to irregular periods or lack of periods at all. So we also have increased risk of miscarriages when there is poorly controlled blood sugar level. Okay, this can lead to the loss of early pregnancies. So when the blood sugar is poorly controlled, it also predisposes a woman to increased occurrence of vaginal infections. So for the
Yes.
of the men, it can lead to erectile dysfunction. It can also lead to low testosterone levels because when the glucose can also lead to reduced libido and sperm production. So it
Wow.
can also lead to the DNA damage of the DNA of the sperm cells.
There's so much time left in this half, but I think what you've really emphasized here is there's just so many issues causing fertility. So, causing infertility. So, what preventive steps can individuals take to protect their reproductive health? Because one of the things we've talked about the issues, we've talked about treatment, but we're talking to the younger ones, talking to people who are thinking of getting pregnant in the future. What steps can they take to protect their reproductive health?
Okay, so they can maintain a healthy weight. They can eat fertility-friendly diets like whole grains, fruits, vegetables, lean proteins, healthy fats. Okay, so they can also normalize the intake of nutrients like folate, zinc, selenium, iron, omega-3 in the form of multivitamins or supplements. So they can avoid smoking, avoid taking excessive alcohol and other recreational drugs. So they can also try to manage stress, as chronic stress can interfere with reproductive hormones. They can practice mindfulness, meditation, exercise, or any other therapy to reduce stress level. They can also try to limit the exposure to environmental toxins, practice safe sex, then monitor menstrual or other sexual health.
Okay, thank you very much. Thank you, madam, for coming on the program to talk to us about your experience. Can you tell us, how did you end up optimizing your fertility health? When did you get married? And can you tell us a bit about your experiences?
Okay, thank you, doctor. Okay, after 2 years of marriage, and you know what people expect of you. After a year or two, they are expecting to see babies. And though I was in a distance marriage, I get to see my husband like once or twice in a year. So after 2 years of trying, we just decided to go for IVF because everybody's looking at me like, what's going on after 2 years? At least by now, we should be seeing a baby. The whole society, pressure from family. We just started to go for IVF.
So even though really technically you hadn't actually fulfilled the strict definition of infertility, because you actually have not been having regular sexual intercourse, your husband has not been around, but you just felt that you needed to optimize your fertility health and seek treatment for fertility because nothing had happened so far. So, what did you do? What made you um, choose the hospital you chose and took you along that path?
Okay, as I said, after 2 years of trying, though I've not been having enough sex as you said, but we just need to do something. Understand? We need to do something. Thank God the society, um, there were options that I could actually go for to make it faster for me. So I had to um consider IVF. Even without my husband being in the country, we had to consider IVF, and went for went for sperm freezing
Okay.
because yeah, we had to freeze my husband's sperm. You know, the circle, they're going through the circle and everything. Him not being around, we had no other option than freezing his sperm. So with that, I was able to achieve a great success. Yeah,
Now you
yeah,
have,
yeah. I have two beautiful girls.
oh, fantastic.
Yeah, They're adorable. So they
Congratulations.
very successful for me. All thanks to God and Bridge Clinic. So
That's wonderful. Well, that's very interesting, you see, because I think sometimes, people wait and people pray. And obviously, it's a good thing to pray.
yeah,
But the waiting can be a challenge. And so prayer along with seeking help, I think for me is the best option. And I'm so happy you did that because also you're introducing onto the program something quite interesting, which is the fact that if your husband is not around, you're able to freeze sperms and so on. So were you able to take advantage of any of the Bridge Clinic Welcome Forum? How did you find out that the Bridge Clinic were able to offer such sophisticated options?
okay. When we consider the going for IVF, we had a lot of recommendation. Many people recommended some hospital in Lagos, But I just said, let me check online to see. So what I just typed in was then I think the best fertility clinic in Nigeria. So I saw Bridge as the first option. It was kind of it had you guys had they had like two branches or three, one in PH. So PH that's Batakot. It was more close to me. So we decided to check it out. Though we just said let's check and see if we can actually go for Bridge. But getting to Bridge Clinic, everything was good. The way the doctors attended to us, the nurses were awesome. The environment, everything was just perfect. So I decided to go for Bridge Clinic. So that's how I came across the clinic. So the doctors
That's
explained. So we decided to go with them.
that's fantastic. And you have a good result. So
Mm.
Dr. Ali, now if I can come back to you as the doctor here. I mean, obviously she was fortunate. She came online. She was able to find out um, about the Bridge Clinic and options through that medium. But what about for people who don't know? Um, I understand you have something called a welcome forum. Can you tell us a bit about that?
Okay, so the Welcome Forum is an event that we organize every last Saturday of every month to try to share and educate people on infertility and what kind of help they can get. Just to let people understand that this is a menace that is eating our society, and indeed there's help. All right, so we try to educate them and we try to let them know what they can benefit and the way Bridge Clinic can actually come in to help them with their infertility issues.
When is the next one and where does it take place? So if people are listening now and they want to talk to themselves, just to find out. Because as I said, some of the things that are being mentioned are not things that people have thought about before and how to overcome some of these issues. If they can have a medium where they can get this advice free, I'm sure a lot of people want to take advantage of it.
Okay, so the next Welcome Forum is coming up on Saturday, 31st
This
of
Saturday?
this
Okay.
Saturday, 31st of May 2025. And the most interesting part of it is that it's free. You don't have to pay any money. So you come, you have this information at your disposal. So for Port Harcourt, it's happening at number 41A Ever Road, Bridge Clinic, GRA Phase 2. In Lagos, it's happening at our Ikeja branch, 66 Oduduwa Way, Ikeja GRA, Lagos. It's also happening in our Abuja branch, on Saturday, 31st of May, all right? And it's also, our Abuja branch is at Jabi Umaru Diko, and then it's also happening in our Victoria Island branch in Lagos. So the time is 10 a.m. It's just a 2-hour program where we educate and let people know everything they need to know about infertility and the
Now,
help.
the problem, some people, they, they have an issue with privacy. Not everybody wants, everybody to know their business. So when they come there on Saturday, is there an opportunity for them to ask questions one on one, or must they stand up and ask it in front of a crowd?
No, we actually offer like a free consultation for anybody that has attended that program and needs to interface or talk with a fertility specialist one-on-one. So yes, you have like a 45 minutes free consultation with a fertility specialist.
Okay, that's great. And I think I'm hoping that people who are listening would take advantage of it because from what I'm hearing, there are new developments in assisted reproduction that can really assist people. So, for example, like our testifier, we thank God she has her two beautiful babies, and it's all happened naturally. So she hasn't had to go through the pains of that. Some people have had to go through, 8 years, 10 years before they finally start seeking help. So I think the key for us now is that, infertility should not be a problem for anyone. If you haven't even got infertility, if you have got if you have a problem, if you haven't got a problem, find out what can be done and how things can be made smooth for you. So, Dr. Ali, tell us now about some of our cultural beliefs and societal expectations that influence fertility decisions and treatment here in Nigeria.
Okay, some people are worried about the stigmatization that comes with infertility. Okay, they don't want to be judged. They don't want people to talk about them. They don't want to come out with their problems because they are afraid. They don't know they don't want people to talk about them. And then we have our beliefs. Okay, in this part of the world, we are very, very religious. So people believe that, at God's time is going to happen. So let us keep praying, let us keep fasting, and let us keep trusting God. Yes, there is nothing wrong in that. Okay, you're praying, you're trusting God. You also have to seek help. You also have to seek help. So some people don't also even know that. Some people are not aware about the infertility situation, and they don't even know that they can get help. Okay, so thank God that people are becoming more aware. People are becoming more exposed. People are becoming more open to the interventions, the help that they can get from trying to know what their situation is. So people are becoming more open, and people are even beginning to accept the advent of IVF and other artificial reproductive technologies. People have moved past the stigmatization. People have moved past the religious beliefs. People have moved past the non-information, okay, the lack of information as it pertains to infertility.
That's fantastic. So anyway, we have come, unfortunately, to the end of the program. I'd just like to ask, Madam, I'd like to give you an opportunity to talk to, our listeners out there, just in case there are any women who are in a similar position to you. What kind of words of advice would you like to give them?
Okay, thank you, doctor. You don't need to wait until it gets to 3 to 4 years, 5 years, 6 years. Just seek help. Seek help when you know you can. Because if I've waited, I might still be waiting till now. So, I'll advise anyone who is in this situation, because everybody wants to have a baby once you're married. Seek help. You don't need to wait. I know many people, during my time, people will tell me it's just 2 years. You shouldn't be complaining. It's just wait 3, 4 years. Maybe if I've waited till now, I'm sure maybe I might still be waiting till now. So if you find yourself in such a situation, just seek help, and then you can keep trusting God. It's still God that gives children, no matter the means or however, it's still God that gives children. So that's it, Doc.
Thank you very much. And
Thank you.
Dr. Ali, for the free sessions available at the Bridge Clinic, can you give a number or any way that people can reach out just in case they need to find out more before Saturday?
Oh, yes, I can give out a number. So people can call 0810-460-7748. And
Can you repeat it, please? Sorry, you just said it a bit fast.
0810-460-7748.
Thank you very much. And do you have any last words for our listeners?
Yes. So my advice is that if you have a problem, you've been having regular unprotected sexual intercourse for more than 1 year, there is help. Seek help. Find your way to Bridge Clinic in any of our branches. See a fertility specialist, have the required investigations done, and so the treatment options available will be put forward to you. Early detection and prompt treatment is key, as age is a very vital factor when it comes to the management of infertility.
Thank you. Thank you very much.
Thank you for watching. Please like, share, and subscribe. for new video updates.